Hi, everybody. Welcome to Dr. Coburn's YouTube. Today, I'm going to cover a new study that just came out on long COVID. Those of you who've been following me for a while know that I'm very interested in this topic. Unfortunately, the expectations that Omicron will come out to be safer in terms of long COVID, Omicron is not coming to be true. So this is a little bit of I think it's part of this is a confirmation, part of it is a concern, and I think it's an increasing concern. And as we have more and more data, we basically seeing that long-term consequences of COVID are going to be with us for a long time. So let's just jump right in. I'm going to share my screen and then put the study up. So this is a study published in a pretty good journal, Lancet. Quite a Lancet Psychiatry, highly respectable journal. This just came out, this is a few days ago. So what was the study and just a basic setup? So they looked at the very large cohort. This is a non-randomized trial. The cohort, though, had over 1.2 million patients in it. And they looked at the records. So if the patients had COVID in the past, then know that the patient that was enrolled into the study. And then the matched controls were the very large group of patients who were equivalent by age, sex, and basic demographics, but different in terms of they didn't have a COVID diagnosis at that time. So there's a lot of data here. I'm going to only show you some parts of the data. You can definitely, and I will put the link to the actual study in the recording, so there's no that you can always come to the actual source of the data. And this is the analysis was going up to 2 years. So this is now the data that being presented from that original when the pandemic just started. There's this sort of unfortunate statement right here at the end, which I'm not going to discuss in a lot further, but it basically says the following. Yes, the deaths from Omicron are much lower. And of course, the number of patients with Omicron was a lot less because the study started way before the Omicron. But if you read this, it basically says that risk of neurologic and psychiatric outcomes remains similar. So I'm gonna skip a lot of stuff. You can always go back and read all this, but what I'm gonna point out to is this specific table. So this is a table 2, and it specifically looks at the risk of neurologic and psychiatric conditions. Now I believe that this is a total population. I will show you a couple other points in terms of specifics in different ages. But if you look at the actual data, the hazard ratio means that there is a risk. So if the number is more than 1 and the p-value is less than 0.05, then that's a statistically significant. When you're seeing such a low p-value of 0.0001, it means it's highly statistically significant. And another way to know that it's a very accurate result is to look at how narrow or broad the range is here, what's called confidence interval. And you can see that, for the example, for anxiety disorder after COVID, the confidence interval is super narrow, only 0.04, but the total increase in risk of 13% is relatively small. Risk horizon means that for how many days you would expect this problem to continue. When there is an NR, that's a bad news. It means there is no horizon. It means the risk is going to be there continuously. And at the end of 2 years, the risk was still highly elevated or highly statistically significantly elevated. So the things that are sort of most concerning here is a cognitive deficit at 36%, dementia at 33%. And then this is a striking, so almost double the risk of this myoneuronal junction or muscle disease, and also this nerve root and plexus disorder. So those are the conditions that in clinic we're seeing manifesting as pain. What's fascinating is that the nerve roots, plexus disorder is a lower risk, so protective, bizarre, but then the muscle disorder, myoneuronal junction, was very elevated, so almost double-fold. So that's those are the findings. And then also psychotic disorders were quite increased. And all combined or composite of any kind of problems was also significantly increased by 13%. So, you know, what this means is that those specific issues, the cognitive deficits, dementia, the muscle disease, and then the psychotic disorders, they're seemingly highly increased risk of those is much higher. And then this is the other data that I wanted to show you. And because this is separates children, adults, and then older adults, it's a kind of a similar presentation of data. Those dots on the right means that the hazard ratio is increased. So if it's up to the right of 1, and if the error or this little line doesn't cross 1, it means statistically significant. So something like dementia in children here, yeah, was elevated, but it wasn't statistically significant. On the other hand, in adults, it actually was very close here. It's crossing over here. And then definitely cognitive deficit, there was a very significant. And if you look at older adults, that's where I think the problems are seemingly the worst, because you can see that confidence interval for dementia and cognitive deficit was very narrow, and so it's a very statistically significant. And if you look at things like the actual percent here, this is much higher. So this is at 50% increase and versus 39% increase in total adults right here. So seemingly older adults suffer a lot more cognitive disability after the COVID. And the scary part that it appears that Omicron is not really going to look better in the long run. The other concern I have is that they didn't really particularly analyze this, but it appears, and there are some comments on them in this article and in some others that I've seen, that repeated COVID infections only increase in risk of all this long COVID concerns. So stay tuned. I think I will look for other studies that are showing similar data, and I will be pointing some of those specifics. You know, if you're interested in long COVID, we are starting long COVID classes on September 8th. So take a look at our gwcim.com website. I'll post the link there. We're definitely going to be addressing a lot of this. We will be helping our patients to tune into how do you actually treat those cognitive deficits that are becoming the result of the long COVID. You know, it's not just cognitive retraining. There are other methods that we will be describing and going into great detail with. So with that, I hope I didn't depress anybody by this post, but I felt like it's important to know this data and stay tuned, stay safe. All the best. Take care. Bye.